Hey guys, I'm Eric Bender at Lakeville Modern Dentistry. I'm right off 35 and Kenwood Trail, and I'd love to take care of you. If you're looking to redo your smile or want to have a more confident smile, we offer veneers and crowns, whitening or ortho, whatever it is that we need to get you that smile that you love and you feel good in. We're happy to take care of you. If you're thinking about veneers, you might have seen the Instagram and the scary peg teeth or whatever. There's a bunch of different ways to get it done. Sometimes they're the best option, sometimes they're not. A veneer is basically a cover that goes over your tooth. It's very thin, and we take a little bit of layer off your tooth, just enough to roughen it and bond that veneer on the front. We can change the shape of your teeth, we can kind of straighten your teeth without doing ortho, and we can make them whiter all at the same time. It's minimally invasive in most cases. Sometimes if you have decay or something going on. Otherwise, we do a crown or something a little bit different. You come in, we'll let you test drive your smile before you commit to the final thing. We can plan it all digitally and you'll see what your smile will look like. And then when you're ready and happy, we can go to the next step and prep the teeth and then get you the veneers locked in and you'll have that smile you want. Let's talk about the pricing a little bit. If you go to some different offices, you'll see that generally speaking, veneers land in a couple different categories. It's either a smile design veneer or it's gonna be something like full crowns and full mouth rehab. There's a couple different pricing attached to that. Generally speaking, insurance doesn't cover something aesthetic like a veneer. So you're looking at something between $1,000 to $2,000 per tooth for a veneer or a crown. It depends on options. If you want a good, accurate price estimate, you can come in, we can tell you the specifics, but ballpark speaking, it's about $1,500 per tooth. And sometimes we can get away with 3 or 4 teeth. Sometimes offices will say that what's gonna look best is back to your molars. It really depends on how much teeth you show. Everyone's a little bit different. There's also different options along the way. It's kind of hard to know off the bat, but we can show you a mock-up of what your smile could look like and some examples and help you through that. Or if you're going somewhere else, good questions to ask are, show me some cases you've done before. Ask them if they're gonna cover the veneer if it breaks. Do you get to test drive your smile? That's a really good option because sometimes you go in and you get them prepped and then you don't have a chance to see what it looks like until everything's cemented and you can't do much then. Also, looking for a place that has a digital scanner is a great option. A lot of offices do it with the goopy impression material, and that's fine. You can get great results with that. And with the 3D scanner, you can actually see everything up on a TV. We happen to have that here, but wherever you go, that's a great tool that can help you get a better outcome. A lot of our patients like to use a financing option. There's different stuff out there, whether it's my office or a different office. You may have heard of Care Credit. It's a credit card for spending on medical stuff. And it's a card that you can use to spend on medical costs. It can be eye care, it can be the dental care, it can be veterinary stuff. Whatever, just so you know, that's a cool tidbit. But they have promotional financing, so you can break stuff into 12-month payments with no interest. That's one option. Other things people like to do is 50% upfront, 50% on delivery. Most offices will offer something like that. The veneer process, when you come in, it's about an hour or 2 appointment. Sometimes it's a little bit longer depending on how many teeth we do. This is once we decide to get started, of course. The first consult's a little bit shorter, it's about an hour or so, even less if you're just meeting me for the first time. No obligation. To get the teeth prepped, it's about 3 hours if we're doing a full top or bottom, and then the lab will actually fabricate the veneers. The lab that we use is a lab actually out in Hollywood. They make the Hollywood white teeth. They make teeth that blend in so natural you can't even tell that they're veneers. And I tend to lean toward natural looking. We don't want everyone to know you went and got veneers, but we want you to have a really nice, beautiful, natural looking smile. But whatever you prefer, we can get you taken care of. The lab will make those veneers. They have really great artists that handcraft each one custom for you with a custom shade. And then they'll send them back and we will cement them in. During those 2 weeks, you'll have temporary veneers on, so we'll let you test drive the smile a bit. And I'll actually wait to send that final lab script to the lab out in California, so that you can see if you like the smile and want any changes first. So you actually have a chance to kind of see it before you lock it in. This is a big decision. It's not something to just take lightly and just go for it. There are a few things that we do to make sure we get it right. We're gonna do a full scan beforehand and then do a mock-up digitally before we even touch a tooth. So you'll see what it looks like. I'm always trying to save as much tooth structure as possible. Veneers are a great way to get aesthetics, but I'm not willing to cut down a perfectly healthy tooth just to a nub, like you might have seen on Instagram, only to get you a smile that's gonna fail in 10 years because you get cavities underneath it. We wanna make sure we do this right. It's really important. You might have also seen some people that get veneers and then it looks like someone stuck a bunch of Tic Tacs on their teeth and called it a day. We wanna watch out for that too. You might have even heard of going down to Colombia or Mexico or Puerto Rico to get your work done. I would caution that. Yes, I can't compete on that price, but you're gonna go down there. You might find a great dentist. They're a good dentist down there. You might find a bad one. It's hard to know. Once you get it done, that dentist says, all done, go back to the States. If you go back there, you think they're gonna recognize you and take care of you if something fails? Probably not. So if you can go to somebody local that has their name out there, that has to stand by their work, I think that's something really important too. Whether it's me or somebody else, just somebody that's in the area, that way that they have to stand behind the work that they do. So if this is something that you're interested in doing, come on and give us a call. The first step is a consult. We can look at your smile, talk about your goals and what you want to do, and then we can come up with some generally ballpark pricing for how many teeth that you're looking to do in. Zero obligation, just a chance for you to meet me and see if I'm a crazy dentist or somebody who would feel comfortable taking care of you.